This next test is for the psoas muscle. That's the muscle that raises the hip up or pulls the hip forward during the swing phase of your gait. I'm going to start off by holding the heel up, and as you let go, you can sometimes see a little weakness as the leg drops down. We'll stabilize on the bony part of the hip here, reach to the inside of the ankle, and have the person resist. Resist. And hold for 4 seconds. You're looking for an instant lock in the resistance pattern. In other words, the muscle should engage right away. You match their resistance with your resistance, and if it gives way, then you know that they have weakness. We'll try that again. Ready? Resist. 2, 3, 4, and relax. She does quite well. Now let's have you bend the knee and hold right there. And on this one, we're just going to push straight forward. Ready? Resist. And she gives way. So we'll do the next part of this test. This is all for the rectus femoris muscle. Ready? Resist. That one she does quite well with. The next one is for the vastus lateralis. That's the lateral quadriceps muscle, and we'll push across at about a 30 to 45 degree angle. Ready? Resist. And she doesn't want to contract. Resist. So that comes right down. That's a weak muscle. You can hold here, and ready, resist. And she can't contract there either. So there's a problem here. We don't know if the problem is because she has a weak muscle or if there's neurological reflex inhibition happening. It turns out that this one is caused by reflex inhibition because she has a big scab on her knee, and it's inhibiting her reflexes, and she doesn't want to contract because there's a sore point. But let's pretend that you have a sore toe, your foot's been injured, something in your chain of action is uncomfortable and painful, and it's inhibiting your ability to contract your muscles. If you have this kind of problem, it's not the time for you to run really hard workouts or pour on the extra mileage. You want to take it easy until these problems resolve, because if you run and can't contract your quadriceps muscles correctly, you're going to wind up getting injured. And you'll have a much deeper, more serious problem that may take quite a bit longer to heal. So if you have these kinds of problems here where there's reflex inhibition, let it heal up before you go for the hard workouts. We'll continue on now and check her hip muscles. So let's have you lie on the left side. And we'll hold this knee, let it bend. Good. Come up. And we're now going to test the piriformis muscle. So go ahead and resist. And that one goes right down. It does not want to contract. Come all the way up. And we're checking the deep internal hip rotators. There's 5 or 6 of them. And I'll go over those with you in just a minute and show you how they work. Don't let me push now. Resist. She's holding quite well there. If we come down just a little bit and resist. And she can't contract. Let's straighten the thigh. Come up like that. Don't let me push. Resist. And that's the tensor fasciae lata muscle along here. That muscle is important because it helps to raise and lower the hip. And that's a critical issue when you're running. Your hip position really determines how much power you can load into your glutes, hamstrings, quads, and calf muscles. Let's have you go on your back now. Face up. Now we'll go to the other side and go through those same tests. Turn the toe out. Hold up. Don't let me push down. Resist. Very nice. Bend the knee. Come up. Resist. And we're going to go to the next one, which is the vastus lateralis. Now we just saw that last muscle on the vastus intermedius and the rectus femoris, quite strong. Resist. And that stands in contradistinction to the muscles we tested on the other side, which were weak. Don't let me push. Resist. Very nice. Go on your side facing that way. Bend the knee. Good. Resist. Come up. Hold. Resist. Good. And we're going to test the tensor fasciae lata again. And don't let me push down. Ready? Resist. Good. Okay, so she tests quite well on those muscles. Let's have you go face down, please. This next one is for the gluteus maximus, and we simply have the person push their foot toward the sky or toward the ceiling, and reach down and resist and relax. That tests the big gluteus maximus muscle. The next is the hamstring. Resist. That's the biceps femoris and semitendinosus. Resist. Good. And resist. Very good. She tests quite well on those with adequate strength. So you bend the knee and push toward the ceiling and stabilize here and ready. Resist. Very good. And relax. Resist. 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 And she's able to engage all of her gait muscles. Now, we haven't tested the tibialis posterior, the gastrocnemius, the soleus, or the tibialis anterior muscles, or the peroneus. So these lower leg muscles remain untested, and I'll show you how to test for those. They're a little trickier.